Hey, Dr. Shook here. As I was reviewing one of my patient files, it occurred to me that one of the things that I wanted to share with everyone that follows me and that is struggling with Hashimoto's are the top 5 clinical priorities that you need to consider. If you're going to get Hashimoto's under control, there are some things that are really important to look at first and to try to address because it can make a huge difference overall. So, number one is, are you dealing with fluctuating thyroid hormone levels? A lot of people with Hashimoto's they go between hyperthyroidism and hypothyroidism. And that's because with Hashimoto's and the autoimmune attack, every time the immune system destroys the thyroid, it spills thyroid hormone into circulation, and that causes a surge in thyroid hormone levels. And this roller coaster of going up and then metabolizing the thyroid hormone and then coming down and being in a low thyroid state, it recurs over and over. And that can actually lead to immune system dysfunction because your immune cells, literally your immune cells, have receptors on them for thyroid hormone. So if you're in a low thyroid state and you're not getting a stable thyroid hormone level, it's going to create problems for the immune system, which can in turn drive the autoimmunity and create more problems for you. Number two is, do you have the appropriate thyroid hormone replacement? Because the thyroid hormone, as I just mentioned, it has a modulating effect on the immune system and every tissue in the body. Literally every tissue requires thyroid hormone. So it's critical. And a lot of people will put off going on thyroid hormone replacement because they want to do it naturally. And all I can say is I've seen a lot of people, worked with a lot of people, and I can tell you firsthand that when people have low thyroid hormone, it's very difficult for them to recover. So if you need thyroid hormone replacement, you really need to be on it so that you can modulate the immune system and have all the benefits of thyroid hormone to help you recover. The third thing is, what triggers can you identify? So a lot of people have triggers, and quite frankly, this is something that you should be paying close attention to because these are immune triggers, things that actually trigger and drive the autoimmunity. So these are things you need to be considering. Lifestyle factors. So for example, when you don't sleep, do you feel significantly worse? If you are stressed at work, do you feel like you're exhausted and you have difficulty recovering? When you exercise, do you have difficulty recovering? Or, do you have problems even exercising in the first place because you don't recover well? Well, those are signs from a lifestyle perspective that there are things that could be affecting your immune system. And there are physiological connections I don't want to get into, but you need to think about lifestyle factors. What you eat is another big part of this because food proteins are known to be triggers for the autoimmune process because as you eat the foods break down, and as they're breaking down, if you have intestinal permeability or leaky gut, the macromolecules, so large molecules, can pass into the bloodstream, triggering the immune response, and they can trigger and drive the autoimmune process. So what foods do you react to? That's a key thing to consider as well. Another thing under obvious triggers, right? Obvious triggers. You want to think about blood sugar. If your blood sugar is getting low and that causes you to not feel well, that can drive the autoimmune process too because of surges in insulin that can occur. When you have spikes in insulin, which is the hormone that helps you to regulate your blood sugar, it drives inflammatory chemistry that can promote the autoimmune process. So high blood sugar and low blood sugar can promote this. Another trigger that you want to observe and think about are any type of what we call antigens in immunology, the study of the immune system. So anything that might be triggering an immune response. So you could think, a lot of times people will think about foods, but also think about chemicals, things in your environment that might be triggering an immune response. Some people have obvious responses when they go into like moldy buildings and they smell mildew. They're getting exposed in a way to typically the volatile organic compounds that molds can off-gas, and that can make them feel terrible. Or another real common one is people that are very sensitive to scents. That can actually be a sign that you're losing tolerance to chemicals, which can really be a suggestion and it can suggest loss of chemical tolerance. So your immune system becomes very dysfunctional. Also, it can be things environmentally that could be triggers as well. Pollens, danders, like true allergens can also be triggers. So anything that can trigger an immune response that you can connect to how you feel and function, these are all things that you need to be taking an inventory of because they probably need to be eliminated in the short term, and you may be able to regain tolerance to these things, but they can be drivers of the autoimmune process. And then the last thing are chemicals and pollutants, some things that a lot of us take for granted, but chemicals that you might get exposed to, cleaning agents, again, scents, like things that the plug-ins and other things that are in the air. If you feel terrible when you get exposed to those, that can be a sign of losing chemical tolerance. So obvious triggers. The fourth thing are really considering nutritional strategies to help dampen the autoimmune process. What strategies can you use to reduce the inflammatory process? And if you don't know this, dietary strategies are really important when it comes to Hashimoto's. The top strategy that I recommend to people that I work with is typically considering like an autoimmune paleo diet, which removes a lot of the common food triggers that we observe in people with Hashimoto's. But unfortunately, everyone has different immune triggers. So if you can do any type of good immunological testing that looks at food allergies, food sensitivities, and food complement protein reactions, that's a good way to get a unique fingerprint for what you're reacting to. And then finally, the last thing as a clinical priority is what mechanisms are impacting immune tolerance. And this means whenever you're autoimmune, your immune system no longer tolerates your own tissues. It means you've lost self-tolerance, and the immune system can attack your own tissues. So you need to think like what mechanisms might be affecting immune tolerance. And one of the most common things are deficiencies in vitamin D. The vitamin D helps with immune system regulation and regulatory function. So if you have deficiencies in vitamin D, this may be impacting your immune system's regulation and be contributing to loss of self-tolerance. So your immune system's attacking you. So just getting your vitamin D levels up to a really healthy, robust level may be very beneficial to someone that has Hashimoto's. Anyway, I wanted to share these top priorities. Number one, are your thyroid hormone levels stable, or are they fluctuating between hyper and hypo? That's number one. If they are, get the immune system under control. Number two, do you have the appropriate thyroid hormone replacement, or are you going into hypothyroid states on a regular basis? If so, this is not good because that directly impacts the immune system. Number three, talked about a lot of things here, but what obvious triggers can you identify? What foods, what type of pathogens, chemicals, what things in your environment might be triggering an immune response? Number four, what nutritional strategies can you use to reduce the inflammatory process? Typically, whole food-based diets, but more specifically, an autoimmune paleo diet can be really helpful for a lot of people with Hashimoto's. And number five, what mechanisms are impacting immune system tolerance? So deficiencies are really common here. Vitamin D is a real critical one. Essential fatty acids can be important. Vitamin and mineral deficiencies like selenium, magnesium can be also very important. But everyone has their own unique fingerprint, things that are driving autoimmunity, but these are the clinical priorities with Hashimoto's. Follow these and it's going to help you out a lot. If you have any questions, need anything, feel free to comment. Let us know if we can help you.